रेडियोग्राफिक टेक्निक सब्जेक्ट रेडियोग्राफी टेक्निक सब्जेक्ट सो रेडियोग्राफी टेक्निक सब्जेक्टको क्वेसनहरू रहेको छ ग्रुप ए ग्रुप बी र ग्रुप सी तीनटै त्यो ग्रुपको रहेको छ 2066 सालदेखि 2069 सालसम्मको क्वेसनहरू मैले सो गरेको छु यस भिडियोमा त्यही भएर भिडियो अन्तसम्म हेर्नु होला है त सो हेरौँ क्वेसन So group A. So question number 1. Define magnification. How is it expressed in radiography? Define magnification. How is it expressed in radiography? Question number 2. Name any two conditions in which expiratory chest X-ray is desirable. Name any two of the conditions in which expiratory chest X-ray is desirable. Question number 3. Which region of vertebral column is most difficult to visualize radiographically? Name the projection of choice for this region. Which region of vertebral column is most difficult to visualize radiographically? Name the projection of choice for this region. Question number 4. What does SID stand for? Write down its value for routine chest radiography. What does SID stand for? Write down its value for routine chest radiography. Question number 5. What do you mean by orthopentomography? Mention any two indications of it. What do you mean by orthopentomography? Mention any two indications of it. Question number 6. Name any four facial surface landmark used for dental radiography. Name any four facial surface landmark used for dental radiography. Question number 7. What is invertogram or babygram? Why is it done? What is invertogram or babygram? Why is it done? Question number 8. Write down the direction of central ray and entry point for following projection. Point number A. Skull submental vortex. Skull submental vortex. Point number B. Stenverse projection. Stenverse projection. Question number 9. Which radiographic projection visualize the maximum part of calcaneum? Which radiographic projection visualize the maximum part of calcaneum? Question number 10. Name the vertebral level at which. Point number A. Abdominal aorta divided. Abdominal aorta divided. Question number B. Esophagus crosses diaphragm. Esophagus crosses diaphragm. Question number 11. Which is the information that is available on the X-ray request form? What is the information that is available on the X-ray request form? Question number 12. Define fracture and inflammation. Define fracture and inflammation. Question number 13. List the bone of upper limb. List the bone of upper limb. Question number 14. What is pleural effusion? What is pleural effusion? Question number 15. Define tomography. Define tomography. Question number 16. Define radiographic baseline of skull. Define radiographic baseline of skull. Question number 17. What is the indication for lateral projection of hand and soft tissue neck? What is the indication for lateral projection of hand and soft tissue neck? Question number 18. Name the different view performed in emergency abdomen. Name the different view performed in emergency abdomen. Question number 19. What is the function of fulcrum in tomography? What is the function of fulcrum in tomography? Question number 20. Write the full form of FFD. Write its value for PA view of chest. Write the full form of FFD. Write its value for PA view of chest. Question number 21. What is FFD? What is FFD? Question number 22. List the indication of hand radiography. List the indication for hand radiography. Question number 23. What are the most common projection for wrist joint? What are the most common projection for wrist joint? Question number 24. Write down the basic projection of thumb. Write down the basic projection of thumb. Question number 25. List the important landmark of skull used during its radiography. List the important landmark of skull used during its radiography. Question number 25. List the important landmark of a skull used during its radiography. List the important landmark of a skull used during its radiography. Question number 26. Define Colles fracture and Smith fracture. Define Colles fracture and Smith fracture. Question number 27. Question number 27. Name the radio. So question number 27. Name the different view performed in emergency abdomen pain. Name the different view performed in emergency abdomen pain. Question number 28. Define occlusal plane and sagittal plane. Define occlusal plane and sagittal plane. Question number 29. Question number 29. Define fracture. So question number 27. Name the different view performed in emergency abdomen pain. Name the different view performed in emergency abdomen pain. Question number 28. Define occlusal plane and sagittal plane. Define occlusal plane and sagittal plane. Sorry, occlusal plane को ठाउँमा occlusal plane हुन्छ है त. Occlusal plane and sagittal plane. So OCCLUSAL हुन्छ है त. यल छुटेको छ यहाँ. मजाले लेख्नु होला है त. So question number 29. Define fracture and subluxation. Define fracture and subluxation. Define fracture and subluxation. Question number 30. List the bone of lower limb. List the bone of lower limb. Question number 31. Write the full form of the following symbol. Write the full form of following symbol. So यी सिम्बलहरु सोधिन्छ है एक्जाममा. सो लेख्नु होला. Point number A. POP. Point number B. LAO. Point number C. PA. Point number D. LAT. Point number E. CXR. Point number F. SID. Point number G. CP. Point number H. RAO and RPO. So point number I. SOD. Point number J. FFD. So point number K. H by O. So point number L. NHPC. So question number 32. What is pneumothorax? Question number 33. Define mid sagittal plane and anatomical position. Define median sagittal plane and anatomical position. MID को full form रहेको छ median है त. So median sagittal plane and anatomical position. So question number 34. List the name and number of bone of lower limb of. So list the name and number of bone of lower bone of limb. List the name and number of bone of lower bone of limb. So question number 35. List the indication of lordotic projection of chest. List the indication of lordotic projection of chest. Question number 36. Define the term decubitus and projection. Define the term decubitus and projection. Question number 36. Why most of the X-ray projection are performed at 100 cm FFD? Give at least 4 reasons. Why most of the X-ray projection are performed at 100 cm FFD? Give at least 4 reasons. Question number 38. What is Port's fracture and pneumonia? What is Port's fracture and pneumonia? So question number 39. Define pes planus. Which projection would you apply for this condition? Define pes planus. Which projection would you apply for this condition? Question number 14. List the important tomographic landmark of pelvis used during its radiography. List the important tomography landmark of pelvis used during its radiography. Question number 41. What do you know by the term baby habitus and spondylosis? है त. So what do you know by the term body? So question number 41. What do you know by the term body habitus and spondylosis? So question number 41. What do you know by the term baby habitus and spondylosis? What do you know by the term baby habitus and spondylosis? So question number 42, define radiography. Define radiography. Question number 43, define radiographic view and projection. Define radiographic view and projection. Question number 44, define the following position. Define the following position. So point number A, left lateral decubitus position. Left lateral decubitus position. Point number B, prone position. Prone position. So question number 45, define coronal plane. Define coronal plane. So question number 46, who and when was X-ray discovered? Who and when was X-ray discovered? So question number 47, what is radiographic baseline? What is radiographic baseline? Sorry, यो क्वेशन दोहोरियो है त. What is radiographic baseline of skull र radiographic baseline भनेको एउटै कुरा हो, कन्फ्युज नहुनु होला है त. So question number 48, what is the radiographic projection is done for foreign body in the hand? Why? What is the radiographic projection is done for foreign body in the hand? Why? Question number 49, write the indication for radiographic of sphenoid bone. Write the indication for radiographic of scaphoid bone. Scaphoid bone है त. So write the indication for question number 49, write the indication for radiographic of scaphoid bone. Question number 50, define radiography and radiograph. Define radiography and radiograph. So हेर्दा उस्ता उस्तै रहेको छ, तर कन्फ्युज नहुनु होला, अलिक फरक रहेको छ है त. रेडियोग्राफी भनेको मेसिन र रेडियोग्राफ भनेको मान्छे है त, रेडियोग्राफर बुझन है त. सो क्वेशन नम्बर 51, डिफाइन बक्सर फ्र्याक्चर एन्ड साइनोसाइटिस. Define boxer fracture and sinusitis. Question number 52, what do you mean by odontoid pig and what is the best projection to demonstrate the odontoid pig? What do you mean by the odontoid pig and what is the best projection to demonstrate the odontoid pig? Question number 53. Question number 52. Question number 52. What do you mean by odontoid pig and what is the best projection to demonstrate the odontoid pig? What do you mean by the odontoid pig and what is the best projection to demonstrate the odontoid pig? Question number 53. What define supracondylar fracture? Write the routing projection of it. Define supracondylar fracture. Write the routing projection of it. Question number 54. List out the indication for apical view. List out the indication for apical view. Question number 55. If a patient come for AXR with acute abdominal pain, frequently AXR supine and erect, which view will you perform first and why? If a patient come for AXR with acute abdominal pain, frequently AXR supine and erect, which view will you perform at first? Why? So question number 56. What do you mean by merchant view? List two indication of same. What do you mean by merchant view? List two indication of same. So question number 57. Give reason why chest X-ray is recommended in erect position. Give reason why chest X-ray is recommended in erect position. Question number 58. List the supplementary and basic view of cervical spine. List the supplementary and basic view for cervical spine. So question number 59. Question number 59. Write the centering point of the projection of sila turcica laterally and ankle AP view. Write the centering point for the projection of sila turcica lateral and ankle AP view. Question number 60. Write down the indication for KUB radiography. Write down the indication for KUB radiography. KUB को full form रहेको छ kidney ureter bladder. So kidney urethra bladder है त. So question number 61. Question number 61. So define Jones fracture and Port's fracture. Define Jones fracture and Port's fracture. Question number 62. Right sort of measure will you apply to protect pregnant patient during pelvic examination? Right sort of measure will you apply to protect prevent patient during pelvic examination? Question number 63. Write the indication for lateral projection of foot and soft tissue of neck. Write the indication for lateral projection of foot and soft tissue of neck. Question number 64. Define the term lateral decubitus. Define the term lateral decubitus. So left lateral decubitus भनोस् या lateral decubitus या decubitus मात्रै भनोस्, एउटै एन्सर हुन्छ है त। क्वेसन त्यही हो। So question number 65. Question number 65. What is the difference between erect and supine chest X-ray in the term of radiography? What is the difference between erect and supine chest radio X-ray in the term of radiography? Question number 66. List the supplementary and basic view for skull trauma. List the supplementary and basic view for skull trauma. Question number 67. Define the radiographic positioning of KUB. Define the radiographic positioning of KUB. So question number 68. Write down the view of sacroiliac joint. Sacroiliac joint लाई यस आईले डिनोट हुन्छ है त। So question number 68. Write down the view of sacroiliac joint. Write down the view of sacroiliac joint. So question number 69. Define the indication of weight bearing view of foot and soft tissue neck. Define the indication of weight bearing view of foot and soft tissue neck. So question number 17. Define the term dorsal decubitus. यो रिपिटेड क्वेसन हो है त, अघि पनि रिपिटेड भइसकेको छ। डोर्सल डेकुबेटस सोधेको छ, सरी अघि ल्याटरल डेकुबेटस सोधेको थियो, यहाँ डोर्सल डेकुबेटस सोधिएको छ। सरी यो रिपिटेड भएको छैन है त। सो क्वेसन नम्बर 17. Define the term dorsal decubitus. Define the term dorsal decubitus. So question number 71. Define landmark and list the example. Define landmark and list the example. Question number 72. Question number 72. Why erect and supine abdomen X-ray are taken? In list the indication. Why erect and supine abdomen X-ray are taken? In list the indication. Question number 73. What is hemothorax? What is hemothorax? Question number 74. What is SID? What is SID? Question number 75. List the indication of chest X-ray. List the indication of chest X-ray. So question number 76. Question number 76. Write down the name of projection which is done only in female. Write down the name of projection which is done only in female. Question number 77. Define mid sagittal plane and anatomical position. यो क्वेसन रिपिटेड भइसकेको छ है त। सो अघि नै यो मिस्टेक ल्याइदियो यहाँ। सो डिफाइन median sagittal plane and anatomical position. Question number 78. What do you mean by dextrocardia? What do you mean by dextrocardia? Question number 79. Define the term decubitus and projection. Define the term decubitus and projection. So question number 80. Write the name of C1 and C2 vertebra. Write the name of C1 and C2 vertebra. Question number 81. Define the acute abdomen pain. Define the acute abdomen pain. Question number 82. What do you mean by radiographer? What do you mean by radiographer? So question number 83. Write the indication of chest radiography. Write the indication of chest radiography. Question number 84. Write the name for basic view of calcaneum bone. Write the name for basic view of calcaneum bone. सो यति रहेको छ है त ग्रुप ए मा, र त्यसै गरी ग्रुप बी मा रहेको छ रेडियोग्राफिक टेक्निक सब्जेक्टको है त। सो ग्रुप बी। सो क्वेसन नम्बर 1. Enlist factor to be taken into considering before performing radiography of patient. Enlist factor to be taken into considering before performing radiography of patient. Question number 2. Which radiographic projection will you perform to demonstrate fat or fluid interface in case of patellar fracture? Explain the procedure briefly. Question number 2. Which radiographic projection will you perform to demonstrate fat or fluid interface in case of patellar fracture? Explain the procedure briefly. Question number 3. What is high kV radiography? Mention its implementation. What is high kV radiography? Mention its implementation. Question number 4. How routine chest radiography is performed? Mention the image evaluation criteria for this routine projection. How routine chest radiography is performed? Mention the image evaluation criteria for this routine projection. Question number 5. Explain the brief radiographic technique for evaluation of cervical vertebra in weight-bearing condition. Explain the brief radiographic technique for evaluation of cervical vertebra in weight-bearing condition. Question number 7. What are the two most essential projections to be performed to rule out a suspected case of abdominal perforation? Explain. What are the two most essential projections to be performed to rule out a suspected case of abdominal perforation? Explain. Question number 7. How mustard air cells are evaluated radiographically? Explain in brief about the radiographic technique. How mustard air cells are evaluated radiographically? Explain in brief about the radiographic technique. Question number 8. Discuss the commonest principle of ICRP radiography. Discuss the commonest principle of ICRP radiography. Question number 9. Enumerate the special feature to be taken into consideration while performing pediatric radiography. Enumerate the special feature to be taken into considering while performing pediatric radiography. Question number 10. Mention the basic radiographic technique for pelvic imaging. Explain the procedure assuming the patient is a woman of childbearing age. Mention the basic radiographic technique for pelvic imaging. Explain the procedure assuming the patient in a woman of childbearing age. Question number 11. What is PNS stand for? Explain about radiographic technique for PNS OM view. What is PNS stand for? Explain about the radiographic technique for PNS OM view. Question number 12. Define chest radiography. What is the basic projection for chest radiography? Write the radiographic technique for PA projection of chest. Question number 13. List the indication of KUB. Describe about radiographic technique for KUB. What is KUB? List the indication of KUB. Describe about radiographic technique for KUB. What is KUB? So question number 14. Which projection is recommended for patella fracture? Describe the radiographic technique. Which projection is recommended for patella fracture? Describe the radiographic technique. Question number 15. Name the basic radiographic projection for shoulder joint. Describe any one in detail. Name the basic radiographic projection for shoulder joint. Describe any one in detail. Question number 16. Describe the radiographic technique for skull. Describe the radiographic technique for skull. Point number A. Tons view. Tons view. Point number B. Lateral view. Lateral view. Question number 17. Question number 17. Write in brief about work drill of radiographer. Write in brief about work drill of radiographer. Question number 18. Describe the radiography technique of scaphoid bone. Describe the radiography technique of scaphoid bone. Question number 19. Describe about dental radiography brief or view for perforated anus in child. Describe about dental radiography brief or view for perforated anus in child. Question number 20. List the indication of elbow joint. Explain the radiographic technique for elbow joint and its projection. List the indication of elbow joint. Explain the radiographic technique for elbow joint and its projection. Question number 21. Write down the basic projection done for supracondylar fracture of humerus. Write down the basic projection done for supracondylar fracture of humerus. Question number 22. Explain the basic view of the clavicle. Explain the basic view of the clavicle. Question number 23. Which projection is recommended for scapular fracture? Describe the radiographic technique. Which projection is recommended for scapular fracture? Describe the radiography technique. Question number 24. For which joint examination Motix projection is done and write down the bone involved in the formation of this joint. Describe the radiographic technique for Motix projection. For which joint examination Motix projection is done and write down the bone involved in the formation of this joint. Describe the radiographic technique for Motix projection. Question number 25. Explain the radiographic projection and radiography technique for calcaneum. Explain the radiographic projection and radiographic technique for calcaneum. Question number 26. Explain the radiography technique for left hip lateral view. Explain the radiographic technique for left hip lateral projection. View. So question number 27. यो रिपिटेड क्वेसन नै हो, अघि नै रिपिट भइसकेको हो, फेरि रिपिट हुँदैछ है त. सो राइट इन ब्रिफ अबाउट वर्क ड्रिल अफ रेडियोग्राफर. राइट इन ब्रिफ अबाउट वर्क ड्रिल अफ रेडियोग्राफर. So question number 28. Which projection is recommended for femur neck fracture? Describe the radiographic technique. Which projection is recommended for femur neck fracture? Describe the radiographic technique. Question number 29. Name the basic radiographic projection for shoulder joint. Describe any one in detail. Name the basic radiographic projection for shoulder joint. Describe any one in detail. So question number 30. Describe the radiographic technique for Townes view. Describe the radiographic technique for Townes view. Question number 31. A child has swallowed a coin. Which radiographic will you perform and why? A child has swallowed a coin. Which radiographic will you perform and why? Question number 32. Describe the radiography technique of scaphoid bone. यो repeated question भइसकेको छ है त. So describe the radiography technique of scaphoid bone. Question number 33. Write about dental radiography. Write about dental radiography. Question number 34. List the important indication of abdomen radiography and explain its radiographic technique. List the important indication of abdomen radiography and explain its radiographic technique. Question number 35. Write down about the basic and alternative projection of X-ray examination of scapula. Write down about the basic and alternative projection of X-ray examination of scapula. Question number 36. What do you mean by Bennett's fracture? Write the radiographic technique done for this fracture. What do you mean by Bennett's fracture? Write the radiographic technique done for this fracture. Question number 37. Mention the indication and radiographic projection of patella. Mention the indication and radiographic projection of patella. So question number 38. What is radiographic baseline? Describe about Townes projection of skull. What is radiographic baseline? Describe about Townes projection of skull. Question number 39. What is 10-day rule? Explain radiographic technique of pelvic. What is 10-day rule? Explain radiographic technique of pelvis. So question number 40. Why do you perform decubitus projection of abdomen inward? Mention its position technique. Why do you perform decubitus projection of abdomen inward? Mention its position technique. Question number 41. What is C-spine radiography? Explain its supplementary projection. What is C-spine radiography? Explain its supplementary projection. Question number 42. Question number 42. Write down the basic radiographic technique for foot. Write down the basic radiographic technique for foot. So question number 43. Explain in detail the basic radiographic technique for ankle joint. Explain in detail the radiographic basic technique for ankle joint. Question number 44. Write the basic Write down the detail the basic radiographic technique for leg. Write the detail the basic radiographic technique for leg. Question number 45. Explain in detail the radiographic technique for knee joint in case of weight bearing. Explain in detail the radiographic technique for knee joint in case of weight bearing. Question number 46. Write down the radiographic technique for thoracic spine. Write down the radiographic technique for thoracic spine. Question number 47. Explain in detail about Y view. Explain in detail about Y view. Y view भनेको स्क्यापुलाको lateral view लाई भनिन्छ है त. सो स्क्यापुला lateral view लाई Y view पनि भनिन्छ. कन्फ्युज नहुनु होला है त. So question number 48. Write down the basic radiographic technique for skull in case of severe injury of frontal bone. Write down the basic radiographic technique for skull in case of severe injury of frontal bone. Question number 49. Explain in detail about lateral oblique view for mustard process. Explain in detail about the lateral oblique view for mustard process. Question number 50. What do you mean by PNS? Discuss the basic view of PNS in detail. What do you mean by PNS? Discuss the basic view of PNS in detail. Question number 51. Discuss about imperforated anus or babography. Sorry, babography है त. Discuss about imperforated anus or babography. Question number 52. Discuss in detail about scaphoid series. Discuss in detail about scaphoid series. So scaphoid को प्रोजेक्सन को नाम सोधेको छ है त. सो series भनेको त्यही हो. So question number 53. Discuss in detail about common projection of skull. Discuss in detail about common projection of skull. Question number 54. List and define the landmark used in skull radiography. List and define the landmark used in skull radiography. Question number 55. Describe the radiographic technique for hip joint in lateral projection. Describe the radiographic technique for hip joint in lateral projection. Question number 56. If the patient is suffering from the rheumatoid arthritis, which projection is recommended? Write patient position, centering point, and image evaluation criteria. If the patient is suffering from the rheumatoid arthritis, which projection is recommended? Write patient position, centering point, and image evaluation criteria. Question number 57. List the different projections that demonstrate patella and describe one of them. List the different projections like that demonstrate patella and describe one of them. Question number 58. Define the following terms. Define the following terms. So point number A, median sagittal plane. Median sagittal plane. Point number B, coronal plane. Coronal plane. Point number C, axial plane. Axial plane. Point number D, adduction. Adduction. Point number E, abduction. Abduction. Question number 59. Which radiographic projection can better demonstrate odontoid peak? Describe the radiographic technique for that projection. Which radiographic projection can better demonstrate odontoid peak? Describe the radiographic technique for that projection. Question number 60. List the basic radiographic projection for shoulder joint dislocation. Describe any one of them in detail. List the basic radiographic projection for shoulder joint dislocation. Describe any one of them in detail. Question number 61. What is S-line view? Write proper technique for this view and evaluation criteria for this view. What is S-line view? Write proper technique for this view and evaluation criteria for this view. Question number 62. Describe technique for lordotic view along with its indication. Describe technique for lordotic view along with its indication. Number 63. Question number 63. Describe the technique for forearm. Describe the technique for forearm. Question number 64. Describe the radiographic technique for leg in detail. Describe the radiographic technique for leg in detail. Question number 65. Define the following terms. Define the following terms. So point number A, OML. OML को full form रहेको छ orbital line. Orbital line. So point number B, sagittal plane. Point number C, high KVP technique. Point number D, soft tissue radiography. Question number 66. Describe radiographic technique for paranasal sinuses. Why mouth is open in PNS OM view? Describe the radiographic technique for paranasal sinuses. Why mouth is open in PNS OM view? Question number 67. Explain the basic projection for the shoulder radiography. Explain the basic projection for shoulder radiography. Question number 68. What is TMJ? Describe the basic technique for TMJ. Question number 69. Describe the supplementary view of vertebral foramina of cervical spine. Describe supplementary view of vertebral foramina of cervical spine. Question number 17. Why preliminary film are taken before examination? Explain along with example. Why preliminary film are taken before examination? Explain along with example. Question number 71. Explain in detail about from projection. Explain in detail about from projection. Point number 72. Question number 72. Explain the basic view of cervical spine. Explain the basic view of cervical. Question number 73. Describe the radiographic technique for Townes view. Describe the radiographic technique for Townes view. Question number 74. Describe the radiographic technique of hand in case of fracture. Describe the radiographic technique of hand in case of fracture. 25. Question number 75. Describe basic radiographic view of SI joint. Describe basic radiographic view of SI joint. Question number 76. What is L spine radiography? Explain its supplementary projection. What is L spine radiography? Explain its supplementary projection. Question number 77. Discuss about radiographic view of open mouth view. Why? Discuss about radiographic view of open mouth view. Why? Question number 78. What is baseline? Describe about Townes projection of a skull. What is baseline? Describe about Townes projection of a skull. Question number 79. Explain in detail about coccyx. Explain in detail about coccyx. So question number 80. How can you perform the radiographic technique for neck of humerus? How can you perform the radiographic technique for neck of humerus? Group C. So question number 1. What are the commonest projection for radiographic survey of a skull? Explain the patient positioning and brief technique for each. What are the commonest projection for radiographic survey of a skull? Explain the patient positioning and brief technique for each. Question number 2. Which is the most mobile synovial joint of our body? Discuss the common radiographic projection for imaging of this joint. So question number 2. Which is the most mobile synovial joint of our body? Discuss the common radiographic projection for imaging of this joint. Question number 3. How radiation protection is achieved during radiographic technique? Discuss in detail regarding patient as well as occupational protection. How radiation protection is achieved during radiographic technique? Discuss in detail regarding patient as well as occupational protection. So question number 4. A patient was brought to emergency department with history RTA. The GCS was found to be 5. The attending doctor suspected for cervical fracture and asked you to perform the radiography. How you will manage the situation? Discuss. A patient was brought to emergency department with history RTA. The GCS was found to be 5. The attending doctor suspected for cervical fracture and asked you to perform the radiography. How you will manage the situation? Discuss. Question number 5. Write short note on. So point number A, artifact. Point number B, foreign body localization. Point number C, traitor radiography. So question number 6, describe the radiographic technique for foreign body in eye. So question number 7, what are the indications for C spine radiography? Describe the radiographic technique for C spine. Point number A, AP view. Point number B, right lateral view. Point number C, left anterior oblique view. So question number 8, describe radiographic technique for the following. So point number A, pelvis AP view. Point number B, apical view for chest. Point number C, calcaneum axial view. So question number 9, list the important indication for chest radiography. Describe the radiographic technique for minimal fluid in chest. List the important indication for chest radiography. Describe the radiographic technique for minimal fluid in chest. Question number 10, what are the indication for the lumbar spine examination? So question number 10, what are the indication for lumbar spine examination? Describe the radiographic technique for lumbar spine. Point number A, AP view. Point number B, lateral view. Point number C, right posterior oblique view. So question number 10, what are the indication for the lumbar spine examination? Describe the radiographic technique for lumbar spine. Point number A, AP view. Point number B, lateral view. Point number C, right posterior oblique view. So question number 11, describe the radiographic technique for pelvis imaging. Write the necessary precaution taken in case of female patient of childbearing age. Describe the radiographic technique for pelvis imaging. Write the necessary precaution taken in case of female patient of childbearing age. Question number 12, define C spine radiography. Explain the radiographic technique for RTA patient in case of examination of C spine. C spine को full form रहेको छ cervical spine. So define C spine radiography. Explain the radiographic technique for RTA patient in case of examination of C spine, cervical spine. So question number 13, describe radiographic technique for the following. So point number A, lordotic view. Point number B, Jones view. Point number C, Cadwell view. So question number 14, list the important indication for chest radiography. Describe the radiographic technique for air in the pleural cavity. List the important indication for chest radiography. Describe the radiography technique for air in the pleural cavity. Question number 15, a patient come in radiology department having history of severe head injury. What are the different radiographic projection you would perform? Explain. A patient come in radiology department having history of severe head injury. What are the different radiographic projection would you perform? Explain. Question number 16, what are the important consideration for chest radiography? Describe the following radiographic projection of chest. Point number A, epicogram of chest. Point number B, chest anterior posterior. So question number 16, what are the important consideration for chest radiography? Describe the following radiographic projection of chest. Point number A, epicogram of chest. Point number B, chest anterior posterior. So expiratory projection of chest PA. Question number 17, explain in detail the radiographic projection for paranasal sinuses. Question number 18, explain in detail the radiographic projection for lumbar spine radiography. Question number 19. Write the short note on. Write the short note on. Point number A. Tomography. Tomography. Point number B. Foreign body localization. Foreign body localization. Point number C. Dental radiography. Dental radiography. So question number 20. Write the short note on. Write the short note on. So point number A. S-line view. S-line view. Point number B. Tons view. Tons view. Point number C. Swimmer view. Swimmer view. Question number 21. Question number 21. Explain in detail. Explain in detail. So point number A. Lumbar AP. Lumbar AP. So point number B. Lumbar lateral. Lumbar lateral. Point number C. Lumbar oblique. Lumbar oblique. र अब्लिकलाई पोस्टेरियर पनि भनिन्छ है त कहिलेकाहीँ मतलब दुईटामा कुनै एउटा लेख्दिनु लम्बर अब्लिक लेख चाहे लम्बर पोस्टेरियर लेख कुनै एउटा लेख्दा हुन्छ है त सो क्वेशन नम्बर 22 एक्सप्लेन इन डिटेल द रेडियोग्राफिक टेक्निक फर एक्सप्लेन इन डिटेल द रेडियोग्राफिक टेक्निक फर सो point number A cervical AP cervical AP point number B cervical lateral point number C cervical oblique Question number 23 in case of SI joint we generally do SI joint of PA why explain in detail the radiographic technique for SI joint in case of SI joint we generally do SI joint of PA why explain in detail the radiographic technique for SI joint. Question number 24. Explain in detail the radiographic technique for abdominal perforation. Explain in detail the radiographic technique for abdominal perforation. Question number 25. If patient swallowed foreign body through mouth which So question number 25. If patient swallowed foreign body through mouth, which radiography will you perform? Write the positioning, centering point and evolution criteria for each. If a patient swallowed foreign body through mouth, which radiography will you perform? Write the positioning, centering point and evolution criteria for each. Question number 26. Explain in detail about the responsibility of radiographer. Explain in detail about the responsibility of radiographer. Question number 27. Explain in detail the radiographic technique for following. Explain in detail the radiographic technique for following. Point number A. Motrix view. Point number B. Swimmer view. Point number C. Silla torsica. Number 28. Question number 28. What is acute abdomen? Describe the recommended radiographic projection in case of acute abdomen. What is acute abdomen? Describe the recommended radiographic projection in case of acute abdomen. Question number 29. Write the basic projection of a skull. Describe the patient positioning, centering point and evolution criteria. Write the basic projection of a skull. Describe the patient positioning, centering point and evolution criteria. Question number 30. Define chest radiography. Write the basic projection used for chest radiography. Explain the radiographic technique for chest PA view in case of detail and image characteristic. Define chest radiography. Write the basic projection used for chest radiography. Explain the radiographic technique for chest PA view in detail and image characteristic. Question number 31. Define basic projection of ankle joint and explain the technique for motrix view of ankle along with the technical factor. Define basic projection of ankle joint and explain technique for motrix view of ankle along with the technical factor. Question number 32. What do you mean by pelvimetry? Discuss in detail about the radiographic projection done during pelvimetry. What do you mean by pelvimetry? Discuss in detail about the radiographic projection done during pelvimetry. Question number 33. Describe the technique factor. Describe the technique factor for. So point number A. Open mouth, odontoid pig. Open mouth लाई odontoid pig पनि भनिन्छ है त. So point number B. Oblique lumbar spine. Point number C, right lateral oblique for sternum. Right lateral oblique for sternum. Point number D. So question number 32. What do you mean by pelvimetry? Discuss in detail about the radiographic projection done during pelvimetry. What do you mean by pelvimetry? Discuss in detail about the radiographic projection done during pelvimetry. Question number 33. Describe the technique for. Describe the technique for. So point number A, open mouth. Open mouth. So open mouth को ब्राकेट मा रहेको छ ओडोन्टोइड पिग. ओडोन्टोइड पिगलाई नै ओपन माउथ भनिन्छ है त. So point number B, oblique lumbar spine. Oblique lumbar spine. Point number C, right lateral oblique for sternum. Right lateral oblique for sternum. Point number D, ball catcher view. Ball catcher view. Question number 34. Explain in detail the radiographic technique for. Explain in detail the radiographic technique for. Point number A, Townes view. Townes view. Point number B, Sternberg view. Sternberg view. Point number C, scaphoid series. Scaphoid series. Point number D, Y view. Y view. So scaphoid lateral लाई Y view भनिन्छ है त. So स्क्याटर मतलब स्क्याफोइड को lateral view लाई नै Y view भनिन्छ है त. So question number 35. What is abdomen series? So question number 34. Explain in detail the radiographic technique for. Explain in detail the radiographic technique for. Point number A, Townes view. Townes view. Point number B, Sternberg view. Sternberg's view. Point number C, scaphoid series. Scaphoid series. Point number D, Y view. Y view. So scaphoid को lateral view लाई नै Y view भनिन्छ है त. So confuse नहुनु होला. Y view भनेको scaphoid को lateral view लाई भनिन्छ है त. So question number 35. What is abdomen series? Discuss about in detail. What is abdomen series? Discuss about it in detail. Question number 36. Write the short note on. Write the short note on. Point number A, ball catcher view. Ball catcher view. Point number B, YM view. V view. YM V view. Point number C, high KVP technique. High KVP technique. Point number D, write the name of facial bone. Write the name of facial bone. So this is the last question of this video. So question number 37. Question number 37. Describe radiographic examination technique for scaphoid series and carpal tunnel. Describe radiographic examination technique for scaphoid series and carpal tunnel.